Thank you, Natalia, for inviting me. It's a privilege to be able to present this two-part slide set, really, or two-topic slide set relating to COVID-19. So I'm going to talk about COVID-19 kidney disease and the immunosuppressed, and COVID-19 isolation, and what does it really mean for the immunocompromised. I am doing this on behalf of the University of Western England in support of the fantastic work that the Renal Patient Support Group is doing, and my fellow colleagues across the pond in the US have kindly invited me to get involved in this. So let's proceed. Next slide, please. So just an overview what I'll be talking about. It looks quite heavy, but hopefully I'll break it down for everyone and why this session was put together. And so what I'll be talking about initially is a bit of background about a poll that was implemented on the Renal Patient Support Group, basic introduction about what is COVID-19, a bit about the immune system, because obviously with patients in CKD and renal failure and so forth, the immune system is actually very important to get some baseline understanding around. Some barrier defenses, some host defenses against viral infections, a little bit about the immunosuppressed and immunodeficiency, CKD and COVID-19, the immunocompromised, CKD dialysis and COVID-19 guidance, goals of care, summary, and some key points to take home. Thank you. Next slide. So a little bit of background. The RPSG, a fantastic group really, has actually done a lot of work for patients in renal insufficiency, acute kidney injury, and chronic kidney disease, and they implemented this poll actually, that took place over a 1 month period in March 2020, which was probably the time when COVID-19 was hitting, its kind of peak period as a pandemic, and the group actually implemented this poll to highlight some key topics really that were choices for the group to get a handle on, and lo and behold, these two topics came up top. So we thought collaboratively we put a couple of webinar sessions together, and this will hopefully be the first webinar that we put together concentrating on COVID-19, and there'll be more sessions to follow. So this is hopefully be an interesting session, but just to highlight, this was information from a poll that was put together first. So thank you. Next slide. So a bit of introduction about what is COVID-19. So coronaviruses are a group of viruses that usually cause mild illnesses such as the common cold. However, certain types of coronavirus can infect the lower airway, causing serious illnesses like pneumonia and bronchitis. Most people get infected with a form of coronaviruses at some point in their lives, and the majority of the infections for the viruses are actually completely harmless. However, the new coronavirus that causes COVID-19, or is under the umbrella of coronavirus, that is COVID-19, is a notable exception. Next slide, please. So what do we know, or what is known about COVID-19 already? So COVID-19 is a new disease, but at the present time, as this webinar took place, there was a limited information regarding risk factors for the severity and severity and severe disease. Based on currently available information and clinical expertise, older adults, particularly the elderly, and individuals of any age who have serious underlying medical or clinical conditions might be at more risk for this virus. Next slide, please. Some understanding about basic terminology, really, I think is quite important to have that. So cases of COVID-19 first emerged in late 2019 when it was reported in the Wuhan province in China. The cause of the disease was soon confirmed as the new coronavirus, so it fits under that under that umbrella of viruses, and it soon spread and became past an epidemic and actually a pandemic. So on the 11th of February, the World Health Organization, or WHO, announced that the official name would be COVID-19, a shortened version of coronavirus disease. This is not the formal name for the virus, however. The International Committee on Taxonomy of Viruses calls it the Severe Acute Respiratory Syndrome Coronaviruses Form 2, or SARS-CoV-2, because it actually relates to the virus that caused the SARS outbreak back in 2003. So when the coronavirus or COVID-19 is highlighted to the through the media to the public, these are the terminologies they use. Is going to be either a coronavirus as a generic term or COVID-19. Next slide, please. So just to highlight the total UK COVID-19 cases update in the UK now. This is a slide that was taken from the Public Health England, and there's a link there to find out and track the trajectory of COVID-19 cases and deaths. This was a slide that was taken on the 10th of April, so soon after the live webinar was done, but equally important. So the total cases at that time was just over 70,000 and nearly 9,000 deaths. In England alone, of those 70,000 cases, nearly 60,000, nearly 60,000 have come from England alone, and just over 8,000 deaths in England alone. When we look at the UK, we put the perspective on England, Scotland, Wales, and Northern Ireland, and so actually the detriment has been quite severe. Next slide, please. Equally, I thought it was important to highlight COVID-19 cases update from the USA. And again, this was data that was identified on the 10th of April. And obviously the total cases and deaths have increased, unfortunately. But at that time, it was just over 400,000 or 450,000 in total cases, and the total deaths at that point was just over 16,000 or 16,500. And this data can be tracked further from the Centers for Disease and Control and Prevention, and there's information around cases, data, and general surveillance. So I thought that would be important to highlight, considering this is a wider audience. Thank you. Next slide. So a little bit about the immune system. Considering that the general population have a different immune responses, it's good to get a baseline understanding about the immune system. So acute inflammation in particular is an early defense mechanism to contain an infection, prevent its spread from an initial focus, and signal subsequent specific immune responses. So depending on what kind of foreign body is potentially attacking the physiology or human physiology, the immune system acts accordingly. So three major events actually take place in acute inflammation. So this is where you have expansion of capillaries, so sort of like blood vessels, and to increase blood flow. And typical example, not specific to virology or viruses, but a baseline experience is perhaps like when someone blushes or has a rash, an increase in permeability of microvascular structures. So along with blood flow increase, you get certain other vasculature increased flow as well to allow escape of fluid and certain proteins and white cells or leukocytes, and that then results in what we call edema, which is swelling of tissue, normally seen at the bottom of ankles, for example. And then number 3 is exit of leukocytes or white cells from capillaries and their accumulation and response to an infection at the site of injury. And what that means, it's as a result, pus can develop. So these are just some basic acute inflammation elements to take a bit of understanding from. Next slide, please. In line with that, I think it's important to get an understanding of certain barrier defenses. Innately, human physiology is pretty amazing. Human beings have 3 basic lines of protection against invasion by infection agents. That could be for protecting against bacterial infections and viruses and other foreign particulars. So these consist of natural barriers such as the skin, mucus, or epithelium, and even gastric acid and bile, and that restricts the entry of agent. And then innate antigen non-specific immune defenses such as fever that acts as a defense as well as a preventative element, and certain immune components, and we'll get into those a little bit later. And then adaptive antigen-specific immune responses such as antibodies and T cells. And just highlighting in a diagram there that you've got, the eyes, the respiratory tract, skin, genitourinary tract, and the digestive system as well. So those are just some outlines of how we have barrier defenses all over us, protecting us and preventing things coming close to us. Next slide, please. So I want to just talk a bit about host defenses against viral infections. Apologies in advance for a somewhat busy slide, but I'll kind of go over this quite quickly. The immune response is the best and in most cases the only means of controlling a viral infection. Unfortunately, it is the only source of pathogenesis for many virus diseases. So unlike bacterial infection, the goal of the immune system or the immune response in a viral infection is to eliminate both the virus and the host cell harboring or replicating the virus. So you can imagine when it comes to something serious like COVID-19, the immune system wants to actually stop basically a host of the COVID-19 to actually be harbored and then replicated. So this is the big thing about personal protective equipment for health professional workers or key workers, and also why those who are immunocompromised and immunosuppressed, they have to be aware of this for these reasons. So interferons, the amazing components really of the immune system, and natural killer cells, certain components like CD4 T helper cell responses and CD8 cytotoxic killer cells, actually very important for viral infections. Failure to resolve the infection may lead to persistent or chronic infection or death, which is why it's such a big thing to know about different types of cell types within the immune system. Body temperature, fever, interferons, or those components, and other components such as cytokines. These are important because they actually provide a local rapid response to a viral infection and activate the specific immune defenses. Often the non-specific defenses are sufficient. So where I mentioned about barriers in the previous slide, those would typically be non-specific in some ways. That they actually help to prevent the occurrence of symptoms in the first place. Interferon is probably the biggest component to take a little bit more understanding of, because it's the body's first active defense against the viral infection, an early warning system basically at the local and systemic levels. So it actually promotes or highlights the need for other certain cell types to get involved in defending or protecting or fighting in the immune response. So it's a very important defense against infection, but ultimately it's also also helps, it can be a cause of systemic symptoms associated with many viral infections, such as feeling tired, or that's called malaise or malaise, myalgia or muscle weakness or tiredness, chills and fever. And it's important to know the differences because fever can be non-specific as well, and it could be like flu-like symptoms. So COVID-19 is going to be much more severe because individuals might have other respiratory problems as well. Next slide, please. So yeah, just a little bit about immunodeficiency. So this may result in main things such as genetic deficiency, starvation, drug-induced immunosuppression, and immunosuppression is an overall category of drugs or treatment, such as steroid treatment, cancer, chemotherapy, chemotherapeutic suppression, or tissue graft rejection, and then cancer causes immunodeficiency. And I think most of the audience will be aware of that in some respects. And then diseases such as HIV or AIDS as well. And then immunodeficiency actually occurs naturally in those who the newborn, young, because their immune system isn't developed yet, and then pregnant women. Next slide, please. So as Public Health England have highlighted, and also the Department of Health in the UK, both organisations have highlighted that immunosuppressed actually are as follows. People at age 65 or older, people who live in nursing home or long-term care home facilities. Other high-risk conditions could include those with chronic lung disease or moderate to severe asthma, people who have serious heart conditions, people who are immunocompromised and on various treatments. In some respects, that could be termed as polypharmacy, those on multiple medications. People of age, of any age, who are at risk or have obesity, other underlying medical conditions, and conditions such as diabetes, obviously CKD or chronic kidney disease or liver disease, which is not controlled very well. And then those who, as mentioned in the previous slide, pregnant women, they also fall at risk potentially. And immunosuppression, obviously for those who are post-transplant, for example, and taking immunosuppression to prevent the organ from rejection or tissue rejection, then that causes a dampening of the immune system. So really, that is why there is a strong message for those who are on immunosuppression to stay isolated or keep isolated for the time being. Next slide, please. And just a quick overview of CKD and COVID-19. So obviously the audience will probably be aware to some extent that CKD is recognized as a silent, irreversible long-term conditions, and much of the monitoring in these patients with the CKD, it occurs at mild or moderate disease, but obviously it can worsen and go into end-stage renal disease. And there's a whole conundrum of clinical pathway about how CKD is taken care of. But individuals tend to have a range of biochemical imbalances, including sodium, potassium, and creatinine. And this puts pressure on the filtering components called the nephrons of the kidneys to rid of toxins from the blood. And then CKD tends to establish itself as a secondary complication owing to obesity, diabetes, or cardiovascular disease, or hypertension. And just to take note that these are all high-risk categories for potentially contracting COVID-19. And it's not actually the CKD itself that is potentially the problem. It's actually the comorbidities that individuals might have or are risk of having that is causing the problem in terms of information to the general public and those who have the disease. The new coronavirus has also been found to be persistent on certain surfaces, and so it's very important to keep sanitized and clean. The viruses could be diminished by ultraviolet light and heat or humidity, but vitamin D, for example, is something that most patients might be on for bone health, and so it's important to keep keep those supplements as part of your general prescription, because you want to keep healthy in that regard. And just to highlight though, however, owing to the nature of COVID-19, it's actually quite important to also note that again, those who are predisposed to certain comorbidities on multiple meds, including immunosuppression, are susceptible to infection, and this is why there's such a important emphasis on being isolated. Next slide, please. So, who are the immunocompromised? I mentioned a bit about who are the immunosuppressed, and immunocompromised. It actually is not all that different. So, those who are on cancer treatment, those who might be smokers or have a history of smoking, those who are have bone marrow and stem cell treatment, those who have had solid organ transplantation, so anything, not just renal, but any other organ transplant, those are on hemodialysis treatment and who have biochemistry imbalances, immunodeficiency, HIV, and poorly controlled AIDS, as mentioned before, and those who are on prolonged use of corticosteroids. Next slide, please. So this slide set really, or this slide information really comes from the National Institute of Care Excellence, or NICE, which is a government body in the UK, and this is their information around CKD, dialysis, and COVID-19. So they've outlined that it's important to outline the restrictions to dialysis and transplant patients owing to the COVID-19 pandemic. It's been important to highlight where there might be a delay in potential dialysis or transplant services treatment plans, outlining risk assessments agreed with local infection control teams when considering using side rooms. So some patients might be needing side rooms to treat COVID-19, and normally those rooms might be used for other purposes. And then considering those who will have pre-existing infections or infectious diseases, and where possible, it may be necessary to encourage patients to have dialysis treatment at home in isolation and keeping to prescribed treatment protocols. And then ultimately, the guidance encourages patients to self-care more because of the pandemic, and so there is a more sense of taking ownership and shared care in that regard. Next slide, please. So what are the goals of care? So the treatment of patients suffering from COVID-19 may be orientated towards, and so what that means is that whoever is who has COVID-19 or is definitely at risk, those who are admitted, for example, they have a person-centered approach. So that's what it means when it's orientated towards. Supportive measures, for example, provision of fluids and or oxygen for those who are identified as severe cases, targeted treatment, for example, provision of antibiotics to treat pneumonia, but this is to warn off flu-like symptoms and not specific to COVID-19, but part of that care pathway might be that if someone has COVID-19, they want to rule out that, and part of that treatment plan might be that health professionals may prescribe antibiotics as admitted patients to warn off pneumonia. And then oxygen support, actually we hear a lot in the media about that. For example, ventilator support, renal replacement therapy might be something that is considered to take off any overload fluid. And those who, for those who are in hospital admitted patients and in intensive care units. So the summary here really is there is ever more importance on ensuring that there is sufficient and appropriate literature understanding from appropriate health professionals around COVID-19. And it's especially probably more important now that that technology is also available for those who feel especially isolated. For example, apps or websites that can be signposted to support those who are in isolation. And that will bring more professionals and patients working together to help bridge gaps. That's important. And then obviously diseases such as COVID-19 and influenza, another problematic illness, can be fatal due to an overreaction of the body's immune system. And so when there's an overreaction, this is when patients who are already admitted and have a need for ventilator support, this is actually a sign when the immune system is overreacting, it has to, there's basically a need for the ventilator to support oxygen and blood flow to organs so the immune system can take on the virus. But when this happens, this is when there's something called a cytokine storm. We mentioned cytokines earlier, but basically that's what happens as part of the immune system, taking a hit and it's overreact. It has to overreact to compensate and to fight off infection. So actually, at the end of it, it's important that professionals and patients work together to understand what needs to be done or could be done better to help bridge gaps in care. So the key points really, nothing new in terms of what's been said by not least the media, but organisations across the globe, CDC, Public Health England, Department of Health, World Health Organization. They're all saying pretty much the same thing, and that is to stay safe, stay well, stay isolated, but also obviously keep active as much as possible in these difficult times. Next slide. So I put together a reading list if anyone's interested. So that's what that list is. Next slide. Yeah, and I was your host, Shahid Mohammed, and on behalf of the University of West England, delivering this for the Renal Patient Support Group. Thank you.